Hi, it's Dr. Christy DeSaffrey, founding physician of Bone and Body Women's Health. Today I wanted to talk about migraines and their association with menopause. Most recently, there was a study published in the Menopause Journal in this February of 2024 looking at women studied in a study called the Cardia study, which was 1,500 women, and they looked at the association of vasomotor symptoms, which are hot flashes, and migraine headache, as well as the development of cardiovascular disease. So really interesting that when we looked at these over 1,000 women who had persistent vasomotor symptoms compared to those who had minimal or no vasomotor symptoms and had migraines. And generally we know that migraines with aura, the ones that are associated with light sensitivity, sound sensitivity, or nausea, blinking lights, etc., are the ones that typically do not get better with menopause and can have some association with estrogen and menstrual cycle. So what they found in this study was that women, again, who had persistent vasomotor symptoms and migraines actually had a doubling of risk of cardiovascular disease. When they adjusted for other cardiovascular disease risk factors like age, smoking, cholesterol, the risk was still elevated. So really important, we've known this for a little while, that estrogen shifts, migraines, all portend higher risks of cardiovascular disease like stroke. So it's really important to know this. If you have migraines, we have many treatments for migraines for women now because the prevalence of migraine is 20% overall, and particularly at the time of menopause, perimenopause. I see a lot of my patients who are headache sufferers, migraine sufferers, that these symptoms are getting worse before they potentially get any better. So really interesting research, always trying to find associations with vasomotor symptoms, migraines, cardiovascular disease. These things are all linked. Hopefully we can develop some associations and help us understand better how we can treat women. We have lots of good options, as I always mention, for treatment of hot flashes, vasomotor symptoms, as well as migraines, both hormonal and non-hormonal. I hope to see you soon.